Secretary, what do we know so far about this new variant? And can we actually say that it's actually going to be worse, or is it worse than the Delta variant?
Oh, we don't have enough data to say that it's worse than the Delta variant because they're still trying to characterize further the features of this Omicron or the B1.1.1.529. Okay, so it's now the Greek nomenclature that's being used is Omicron. So what they know is there seems to be a lot of mutations in the spike protein. Okay, and whether these mutations that has brought about this Omicron variant will affect the following. Number one, is it going to be, it looks like it's more transmissible, okay? But how much more transmissible is it? It's not very clear. Now, is it more virulent? That they're still trying to find out. Is it capable of an immune response, meaning it can escape the protection that the vaccines provided in the human body? So they're looking at all of this. If this going to have more severe clinical outcome? Is it going to be more serious? Is the antibody being produced going to be as effective in terms of the immune response to the vaccines? So a lot of this will have to be further studied and characterized.
Secretary, we know so far that we've already suspended several flights, rather, to prevent its entry to the country. But what is the government's next steps after this travel ban that we have imposed? Should the public expect perhaps the restrictions to be tight again?
No. What we need to do is the more disciplined compliance with the minimum public health standards. So, whether it's an alpha, beta, delta, kappa, or Omicron variants. So, it has been proven time and again that the minimum public health standards are effective. So, wearing of the mask, hand hygiene, use of sanitizers or disinfectants, physical distancing, and other social measures. In fact, even face shields in the closed spaces, crowded areas, as well as in close contact settings. Maybe of additional protection. So all of these we need to do, and we've been doing this, in fact. So we just have to be more disciplined in terms of compliance.
Sir, Hong Kong has already recorded at least 2 cases of the variant. Do we have any plans, perhaps, the government, including Hong Kong in its travel ban?
Yeah, we're waiting today whether of course, Hong Kong, they've already identified Belgium, Israel, Botswana. So there should be an additional number of countries that will be included in our travel ban. But we are waiting for our experts to give us a more definitive recommendation. And that's going to happen between now and about 6 o'clock tonight.
Secretary, we certainly hope that it doesn't get, to a level that it's going to be overwhelming again for our hospitals. But should it happen, is our healthcare system ready for another surge?
Well, it's going to be difficult, I'll tell you, because, we have just had a surge or spikes in September. We had the peak number of cases in September. So, barely 2 months, no? If hopefully this does not bring about another spike over the short term. We are looking at and hoping that if there's going to be a spike, which is a possibility, as you can see, in Western Europe, even if their vaccination coverage is relatively high at 80%, we see that they are experiencing their fourth wave. And that may very well happen to us. So we need to be careful. We need to really comply with the minimum public health standards, other public health and social measures. And, of course, the vaccination is one of the key solutions to responding to the COVID-19 pandemic, whatever the variant. No? Mm-hmm. So we're still awaiting the WHO further advisory. They are meeting. I think they met yesterday. This is the Technical Advisory Group on Virus Evolution.
Mm-hmm. Sir, given you mentioned vaccination and given the increased mobility, even for the younger ones, do you think or would you recommend now that perhaps is a time to roll out boosters for the general population and again, shots for the younger ones?
Well, the booster, what is more effective is to give the first dose to the people who have not even received any drop of vaccine. No? So that is the more important strategy, more than the booster dose. It has already been shown that if you provide the first and the second dose of the primary series to individuals who never had the vaccines, the population protection is going to be a lot more effective.
Mm-hmm. So I would also like to get your insight, Secretary, because the Concerned Doctors of the Philippines wants other treatments, such as ivermectin, to be considered. What are your thoughts on this?
Well, they have been pushing for that. And we are just, we continue to listen to them and to the new developments or findings. And so far, there seems to be no clear or definitive indication that this is effective for COVID infection. It's good for parasitic infection, but for COVID, there is really a conflict of findings or data. So one side would say it is effective, the other side it's not. So let me just say also that the fact that we were able to bring down our cases quite substantially over the last 2-3 weeks, even if we didn't give ivermectin throughout and to all these people, we see a continuing decline of our COVID cases. In fact, in NCR, we're only below 300 now, no? Which is really never seen before. So, they cannot say that this is because of ivermectin, because I don't think many people took ivermectin, only very few. What we know is that NCR has had 94% completed vaccination coverage. And that also has helped a great deal in bringing down the number of cases.